Hello everyone, this is Dr. Garima Sachdeva, and today we'll be discussing about it is a commonly repeated question in your part 2 exam when they ask you about the recurrence of pregnancy induced hypertension in the subsequent pregnancies. So they can give you scenarios like if a patient has gestational hypertension in this pregnancy, what is the risk in subsequent pregnancy? A patient has preeclampsia in current pregnancy, what will be the risk of recurrence in subsequent pregnancy, or any other combinations like this. So this is repeatedly tested in your exam, so please go through this video. Mostly it should be helpful for you.
Then about the recurrence, likelihood of recurrence. So sometimes they ask you this question also. So if the patient had, what is the recurrence of any hypertension? Okay, if the patient has any hypertension, preeclampsia or gestational hypertension, so what is the recurrence of having any type of hypertension? So it is 1 in 5. If any of these is there. Okay, then gestational hypertension, G is a 7-letter, like if you count A, B, C, D, E, F, G, G comes at number 7. Okay. So if there is gestational hypertension, you can remember that risk of developing gestational hypertension in subsequent pregnancy.
Okay.
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 So this is how you can remember this. Then again, if the patient has gestational hypertension, risk of preeclampsia is preeclampsia. You can remember like it's a 2-letter word, so it is almost double, 1 in 14. It is.
Okay.
You can remember. Just if there was previously gestational hypertension, then risk of preeclampsia is 1 in 14. Risk of any hypertension is 14%. Okay. If there was any hypertension, risk of preeclampsia is 14% or 1 in 7. So this is generally not asked. What is commonly asked is if there was previously gestational hypertension, risk of gestational hypertension in subsequent 1 in 7. If any hypertension, any type, preeclampsia or anything is there and of developing any hypertension, it is 1 in 5. Okay. This is commonly asked. Then if there was this thing, gestational hypertension, risk of preeclampsia is double. Here it is 1 in 7. It is 1 in 2. 1 in 14. Sorry, is half. Preeclampsia, the risk is half, 1 in 14.
Okay.
Then if there was previous preeclampsia, risk of subsequent preeclampsia, it depends like when the onset was there. Overall, it is 1 in 6. If the if you divide it between 28 to 34, it is 1 in 3, and 34 to 37, it is 1 in 4. Okay. Understood?
Yes.
If there was preeclampsia, overall risk of developing preeclampsia in subsequent pregnancy is 1 in 6.
Actually, how to read this tabular column? What are the left sides and what are the above ones?
Yeah, so this is current pregnancy if there is something. So if there is a gestational hypertension in current pregnancy and the patient asks you what is her chance of getting gestational hypertension
next future pregnancy.
So then it is 1 in 7. So this you have to you can remember it like for gestational hypertension it is
7.
7.
Preeclampsia 14.
Preeclampsia 14. So these are the two numbers which are frequently asked. The other thing is not that common. Overall, if any hypertension, if whether it's preeclampsia or gestation hypertension, it is 1 in 5. Okay, any hypertension if they ask you.
1 in 5. Okay. 7, 14, 5.
And then if it is for preeclampsia in current pregnancy, any hypertension is 1 in 5. Subsequent preeclampsia in subsequent pregnancy is 1 in 6. Okay, 5, 6, and 8. Gestation hypertension is 1 in 8.
Preeclampsia in current pregnancy.
Risk in future pregnancy is 1 in 6.
So just to summarize, if there is any hypertension, then risk in the current pregnancy, risk of developing any hypertension is 1 in 5. If there is preeclampsia, again risk of developing any hypertension is 1 in 5. If it is gestational hypertension in current pregnancy, then again risk of any hypertension is 1 in 5. In case there is preeclampsia, risk of recurrence of preeclampsia in the subsequent pregnancies 1 in 6. This has been asked even in the 2024 exam. So risk of recurrence of preeclampsia is 1 in 6. This is something which you have to remember. And risk of recurrence of gestational hypertension in subsequent pregnancy is 1 in 7. And if a patient has gestational hypertension in the current pregnancy, risk of developing preeclampsia in the subsequent pregnancy, it is 1 in 14. So I hope it was useful. Thank you so much for your time.